Well, you know, we all know this is a critically important time for a country, and you know, we got to make our voice heard. And my feeling is we as the National Academy of Medicine has the experts, such as people reflected here, and convene the experts to say, what do we need to inform the next U.S. administration, whether it's the president, the Congress, or all their stakeholders, of not so much what is wrong or right with Obamacare, but more issue is what else do we need to do to move things forward. So we have a wonderful panel. I can't think of a greater group of people that I want to spend this afternoon with. And so it's Mark, who's my co-chair, as you know, is director of the Duke Margolis Center for Health Policy at Duke University, and he was a former administration of CMS and also former commissioner of FDA. So he comes with a lot of knowledge and credentials. Risa Lavizzo-Mourey, already been introduced a number of times. In fact, I gave a shout out this morning. Yeah, President and CEO of Robert Wood Johnson, a major health leader and really understand the issue of culture of health and things that we're going to be talking about. Larry Tabak. Larry is the Principal Deputy Director of NIH and really has many leadership roles in moving forward a lot of NIH leader activities, the roadmap to support science, directors' initiative to enhance peer review, and on. But importantly, he understands the science and technology. We're so glad you can join us, Larry. Tom Daschle, the Honorable Tom Daschle, a good friend. He is now the founder and CEO of the Daschle Group, the former U.S. Senator from South Dakota, and the former U.S. Senate Majority Leader. Tom has done so much and understand the government. We certainly look forward to knowing your wisdom, Tom. And of course, Governor Mike Leavitt, another good friend who's the founder and chairman of the Leavitt Partners, where he helps clients navigate this, the future as we transition now to a new and better models of care. And as you know, Mike served in the cabinet of President George W. Bush as administrator of EPA, secretary of HHS, and 3-time elected governor of Utah. So we're all set. I think each one, I'm going to ask the same question. That is to say, if you have 3 minutes, or maybe 5, with a new president, what would you tell her or him? So let's start. Let's start with Risa. Risa, you're a leader in public health, and you know that based on your participation in the writing of the vital directions and reading about this and your own experience, if you have 3 minutes with the next president, what are the key challenges and necessary priorities you highlight to advance better health and well-being?
Okay, well, thank you, Victor. I think you asked us to imagine we were in the elevator.
That's right.
So as soon as the elevator door closes, but when it closes, I would remind the president that we spend $3 trillion on health care and that we're not the healthiest nation by far, and that health really is a means to the end of what we all want. Prosperity, personal fulfillment, and a safe and prosperous country. So I would make 4 recommendations. The first is making improving health broadly defined a core value of your administration. Ensure that the health and the impact on health and continuously improving health is a consideration in all policies. And make sure that improving health is a critical goal for communities and people within those communities at all levels. Use the policies, but also the bully pulpit of the administration to ensure that health, particularly among local communities and ordinary people, is something that gets priority. Second, commit to measuring and reporting on our progress. I would urge that you implement a parsimonious set of measures that can track progress at both the national and local level. And these measures must, of course, be valid. They must measure health broadly, including the social determinants of health and the outcomes of health care. And then I would probably point them to the National Academy of Medicine's measures and selfishly to the RWJF measures as well. Third,
the vital signs.
Yes.
Yes.
Third, create standards for digital interoperability and platforms and structures for governance that would enable information to move seamlessly from public health to social services to medical care, so that we could ensure that people get the kinds of supports and services they need, irrespective of where they live and who they are. I would remind the President that this kind of platform has to be applicable to all age groups, but would also remind the President of Frederick Douglass's words, "It's easier to build strong children than to repair broken men." And fourth, I would urge the President to redesign how we pay for health care so that we're paying for healthier populations and not volume-driven, fragmented sick care. The incentives need to reward outcomes, better coordination, and the integration of social services, and ultimately to improve the population's health. About this time, the elevator door is going to open, and I would not give any more detail because I know the President is going to hear an earful on this from one of the other participants.
Perfect.